Hi there, I hope you're all well today. Today's subject, we're going to talk about introducing those common allergy foods and what reactions to look out for, so to know whether your child is having a reaction to them. We now know that 1 in 10 children under the age of 1 year old are diagnosed with a food allergy. So the good news is that a vast majority of them will grow out of their allergy by the time they get to school age. But 1 in 10 is a pretty significant number. So it's really good to know exactly what you're looking for when you're introducing these foods, whether you should introduce them or not. There's so many questions around this. So when it comes to the common allergy foods, that's the top 9. So that's things like peanut, tree nuts, soy, sesame, wheat, egg, milk, or, dairy, fish and shellfish. So those are the top 9 allergy food, and they cause 90% of food allergies that are diagnosed. Australia is the worst country in the world for food allergy, for childhood food allergy specifically, and we don't really know exactly why, but there's strong evidence to show that it's because we're such a multicultural country, and when children are born out with their country of origin, there is an increased risk of food allergy. So that is that's not, some of that is evidence-based, but it's a pretty good, guess, basically, because that's, it's been shown that Asian children are much more likely to have a diagnosed food allergy when born in Australia than born in the country of their parents' origin. So with those top 9, we get a lot of questions, when should we introduce, how should we introduce? So we'll go through that today. And basically the simple answer is you should be introducing all of those top 9 before the baby is 12 months old. You can start, we should be starting to wean between the age of 4 to 6 months, not before 4. Make sure that the child has good head control, make sure that they're able to sit up, make sure that they're showing an interest in wanting to feed, and really just making sure that they're ready. Children aren't all ready at 4 months. My children weren't actually ready until they were nearer 6 months, so that's fine, that's not wrong. And then basically there's no specific way that you have to introduce these foods. There's nothing wrong with putting a teaspoon of peanut butter in your baby's mouth. Just that there's a couple of big no-nos, and the first one is absolutely do not rub the food, like the nut butters or anything like that, on your baby's skin, because number one, that's a way to sensitize them and make them highly sensitive to something on their skin that could show a specific redness in that area, but it doesn't tell you if they have an allergy or not, because allergy lies inside the blood, and allergic cells, if you like, sit onto your mast cells. By rubbing something on a baby's skin is not going to tell you if that baby has an allergy or not. Even if it goes red, it doesn't mean that your child has an allergy. So don't rub things on the baby's skin or on the outside of the lip. Some of the ASCIA protocols say about inside the lip, but actually a lot of the time we just start with a tiny bit of the food. The other big no-no is waiting until after the 12 months to introduce these foods, specifically if you or the immediate family have a history of food allergy or eczema or asthma. That criteria is a reason for you to introduce these foods sooner rather than later. So you can get that peanut butter in there before they're 6 months old. That's it. We know now that the quicker we introduce, the earlier we introduce these foods, the less chance there is of a child having a food allergy. That doesn't mean to say that just because we get all these foods in before 12 months that they won't have a food allergy, but we know that that's the biggest way to make a dent in childhood food allergy. It is bringing down the numbers by getting those foods in early, which unfortunately is completely going against what the medical profession was saying just even a decade ago. It was all about avoiding all these foods until they were 2 or 3 years old, but we now know that that isn't accurate. So I'll go through some of the symptoms, and then in a separate video, I will show you a way that you can introduce these foods to your child. It's not the only way to do it. There is nothing wrong with just making a dippy egg and soldiers and giving your child egg for the first time. But the way I'm going to show you is purely for people who may feel anxious, nervous. They want to do it bit by bit. Maybe you've got other children with food allergies, or maybe you're just nervous and you want a structured way to do it to see if there's any reactions. So that's a way I'm going to show you, but it's not what you have to do. Okay, so it's just a strategy that you can use. So when you're introducing these common allergy foods to your child, there's some things to look out for when it comes to an allergic reaction. There's a mild to moderate symptoms, and then there is the symptoms of anaphylaxis, which are the severe symptoms of an allergic reaction. So anaphylaxis is just another word for severe allergic reaction. So the mild to moderate symptoms, they can look pretty full on, but they're actually still just mild to moderate, and they're not the symptoms that make us worried. So they are hives or welts. So, you know, the big or small white kind of marks, like bumps that usually have a red flare around them. Swelling of the lips, face and eyes. So eyes and sometimes the ears as well. Tingling in the mouth and abdominal pain and vomiting. So they can get quite an epic tummy ache from having certain foods. So abdominal pain and vomiting is just a symptom of mild to moderate food allergy, but just know that in a bite or a sting from an insect, that is actually a sign of anaphylaxis, okay? So then we can go on to the signs where we would need to call an ambulance if any of these symptoms happened with a food. Also, I'll just backtrack. A child can have an allergic reaction to any food. The foods that I've described are just the top 9, and they are responsible for 90% of food allergy. But just know that a child can have a reaction to any food, or a person can have a reaction to any food at all, okay? So the signs and symptoms of anaphylaxis are a difficult or noisy breathing, a swelling of the tongue, because obviously that then compromises the airway, a wheeze or a tightness in the throat. So the wheeze sometimes you can hear it, and the tightness in the throat, a child might grab at their throat if that's happening. They can also be quite tingly in the throat, but a good question to ask a child if they're of the age of being able to speak to you is, does it feel like a stone in the throat or does it feel like bugs in the throat? Now, bugs in the throat is tingling, a stone in the throat is swelling. So it's the swelling that we want to be careful with, and that's what, if we need to know if there's swelling in the throat. They might have a wheeze or a persistent cough. So a wheeze is what you can hear, it's what people associate with, you know, asthma. But a wheeze comes from the swelling of the airways and the swelling of the lungs. A persistent cough is probably one of the most common symptoms of food allergy that we see. And it's not necessarily a big hacking cough. It's just a cough that comes out of nowhere, usually just after your child has eaten that specific food, and it won't go away. So that is a symptom of anaphylaxis. Difficulty talking or a hoarse voice, or if the child is very young, like if they're between 6 to 12 months, then their cry will sound different, and that's the voice box being constricted. Persistent dizziness or collapse, and that is for a slightly older child, a child that can tell you that they actually feel dizzy, or with a younger child, they can just go pale and floppy, and that's the blood pressure dropping, and there may be no other symptoms. So just know that these symptoms don't have any order to them. They may not get any hives or welts or vomiting or anything. They may just go straight to pale and floppy. There's no order in these. So we can know from skin testing and a good history whether a child has an allergy, but we can never, ever tell anyone how severe that allergic reaction will be. So it's really good just to know the symptoms of what you're looking for. If your child is showing any of these symptoms of anaphylaxis, then we need to immediately sit or lay them down. That's really important. If they won't lay, then at least sit them down. We need to call an ambulance. If you have an EpiPen, this is where you would give the EpiPen and then call the ambulance. But most of the time, if you're just introducing food, you won't have an EpiPen. You won't know that there's an allergy. So if any of these symptoms, sit or lay them down, definitely keep them still, because we need that blood pressure to regulate, and call an ambulance, okay? So in our next video, we will talk about the strategy of how to introduce food slowly, okay? Speak to you later. Bye-bye.